Good morning, good afternoon, and good evening to everyone. And thank you so much for taking out the time and joining us for today's informational webinar for the 6th annual Health Systems Innovation Hackathon brought to you by the Harvard Health Systems Innovation Lab. This year, PATH and the Youth Ownership of Digital Health Initiative are proud to partner with this wonderful initiative that is focused on building high-value health systems leveraging artificial intelligence. I'm Pallavi Jain, and I will be moderating the session today. I'm also leading the Youth Ownership of Digital Health initiative at PATH. YO.DH, or the Youth Ownership of Digital Health, is a community of young digital health professionals across the world who are under the age of 35. Our vision is to empower young professionals in the digital health sector to become future leaders in this space by providing them with increased representation, knowledge, and networks. We are already a community of close to 1,000 members across 34 countries. If you want to become a member of the youth community and participate in different events, webinars, and other initiatives, you can log on to our website and become members. Today, we are joined by some of the very distinguished members of the Harvard Health Systems Innovation Lab team and have been instrumental in putting together the 6th annual hackathon that is taking place on the 11th and 12th of April across innovation hubs in North America, Central and South America, Europe, Asia, and Africa. They will be sharing more information with us that could help all of you apply for the hackathon and prepare for the same. I would quickly like to introduce Dr. Caroline Balstra. Dr. Caroline is a postdoctoral research fellow at the Global Health and Population Harvard T.H. Chan School of Public Health. Her research at the Health Systems Innovation Lab focuses on optimizing healthcare delivery for chronic diseases. She earned her PhD at Erasmus MC, applying geospatial modeling to optimize prevention and control strategies for HIV, malaria, and neglected tropical diseases. Caroline leads the Global Health Systems and Planetary Health Group at the Heidelberg Institute for Global Health and has consulted for the UN organizations, including the World Bank, UNAIDS, and the World Health Organization. She holds degrees in veterinary medicine and epidemiology from Utrecht University and Erasmus University at Rotterdam. Thank you so much, Dr. Caroline, for joining us today. We also have with us Dr. Anne Bishops, who is a physician and postdoctoral research fellow at the Health Systems Innovation Lab at Harvard, where she investigates health systems performance for children and adolescents. She is currently working on the GC-CDIC project to examine health systems performance in relation to diabetes and mental health in children in 33 countries. She has been directly involved in the research and care delivery projects, focusing on improving chronic diseases and mental health care for adolescents since 2020. And thank you so much for joining us. And I leave the floor open to both of you to tell us a bit more about the hackathon. To all our participants, in case you have any questions, please use the Q&A feature and put down your questions. And through the course of the webinar and towards the end, we'll definitely take them up. Thank you so much. Anne and Caroline, over to you.
Yes, thank you very much for this kind introduction. Very nice to meet everyone. We will start with a short overview of the hackathon. Yes, Caroline, over to you.
Great. Yeah, so thank you all for joining today. We're excited to share more about the Harvard Health Systems Innovation Hackathon, which is coming up soon on the 11th and 12th of April. So thank you so much, Pallavi, for the kind introduction. I will, during this short presentation, share a little bit more about our lab and the general structure of the hackathon, and then Anne will take over and tell more about the registration and venture incubation program that will follow after the hackathon. Next slide. Yeah, so I'll start with a little bit more about the Health Systems Innovation Lab. So we're a lab based within the Harvard School of Public Health. We are founded in 2020 and are currently with a team of 30 core members and many research scholars, a very international group. And our focus is on education, research, and next to that also on translation and innovation. And what really makes our lab unique is the focus on innovation in healthcare and health systems. And our flagship event within the innovation space is the hackathon, which we organize every year. Next slide. So the hackathon overall is meant to, together with students and young professionals around the world, come up with solutions to move towards high-value health systems globally. So here you see the brief kind of framework that our work is focused on. You can also find it online or later in the slides. But it consists of 10 different components. And this year during the hackathon is focused on building high-value health systems through artificial intelligence. So we really encourage all the participants and team joining to kind of look at the framework and be creative, be innovative in seeing where AI can support us in moving towards better health systems around the world. Next slide. Yeah, here a little bit more about previous hackathons. So we had the first hackathon in 2018, and we've had annual hackathons ever since. We grew tremendously since then. So last year, our hackathon had 8 different locations, including Boston, and we had over 500 participants. This year, we have 20 hubs worldwide, as Pallavi said, in every world region, and already over 3,000 registrations. So we're really excited to really kind of truly host the first really global hackathon. And we hope we'll see you there. And here you see some pictures of kind of the start of the hackathon. I think we also have more. Yeah, we can go to the next one. Okay, you show the map, and yeah. So here you see the locations of the different hubs. Anne and I will be based in Boston, and then we have organizers across the world. And as Pallavi said, we partner since this year for the first time with PATH. And we have 5 or 6 different hubs through PATH in Africa and Asia. So very excited to partner with you. Next slide. So yeah, a little bit more of the hackathon. You might have heard about hackathons before because it's a type of event that we've seen more and more often since recent years, also in the healthcare and health system space. But just to kind of give you a brief idea of what is expected from you during the hackathon. So the hack will be 2 days, and you'll start with forming teams if you haven't done so already. Like you can join as a team already, or you can join individually and then team up with other people during the beginning of the hack. And then together with your team, you'll identify a problem, a specific problem within health systems that you want to focus on. So this can be a problem kind of really in your local country or context, but it can also something that happens more globally. Then once you've done that, you'll start working on generating ideas. Really specifically, this year tailored to artificial intelligence. And then by the end of day 1, you will officially kind of register with your team and already share a little bit more about your idea. And then really team up and further develop the idea. There are at every hub many mentors available that can support you with kind of further developing your idea, and they can help you like answering many different questions. And then day 2 will arrive, where the overall purpose is to focus on kind of creating an overall proof of concept or prototype of your idea. Of course, 2 days is very short, so it will kind of really be an initial idea. And then at the end of day 2, you will briefly present your idea with your team in front of a panel of judges. Next slide. So what do you get out of the hackathon? What makes the hackathon really exciting and unique is that you will collaborate in multidisciplinary teams. You will practice problem solving and really kind of adapt the mindset of identifying problems and figuring out together with your team how you can solve them locally. You will have unique access to mentors and guidance for your problem solving specifically, but also to get a better understanding of how the innovation and startup world works. And then also kind of, get support with prototyping and get access to health systems ecosystem locally and also to our global network. Next slide. Great. So Anne, do you want to take over from here?
Yes, sure. So thank you for the overview. So how can you enter this year's hackathon? The registration deadline is next Monday, so on the 31st of March. And you can scan either this QR code here, or you can click this link, which Pallavi has also kindly posted in the chat already. And then there's a short application form asking you some short questions about your background, and also potential ideas you might have already. And we are really looking for multidisciplinary teams. So we are looking for students, young professionals, postdocs, researchers. The main criteria is that you're just passionate about bringing up AI solutions to improve healthcare systems. And you can come from a medical background, engineering, from a business background. And we encourage teams to really try to have a combination of all of these backgrounds to really take advantage of all of your expertise. And there we also focus on, everyone can join, but we have a major focus on early stage innovations. So you can really start to form your idea during the hackathon, or maybe you've already started to work on an idea and try to take it further. This is both an option. And then there's also often the question on how we will judge the winning teams, and we will focus on what is the challenge itself, how well is the problem statement refined and really addresses a critical gap. Then we will also judge your innovation itself, how well is the technology thought through, what is the rationale behind it, does it really address for example, the low income setting you were targeting, what are the components and what is the design? I think here it's important to remember that you do not need to have a functioning prototype, as we have only 2 days and you may start forming teams on the first day. So what we are really looking for is this well thought through idea that you're able to present on the second day in your pitch. So it's really all about the pitch. You don't need to coach. You can decide to show something on the second day, but it's not necessary. Then we will be judging on the implementation, how you would like to get this started, your team. So once again, try to be as diverse as possible. And then also how well you presented your pitch and how well you were able to answer any questions the judging panel might have. So what happens after you might have won the hackathon? From each hub, there will be 1 to 3 winning teams, and they will first enter a 2-week bootcamp phase where you will have individualized mentoring and seminars to further refine your pitch, which you will then pitch to a global judging panel, including different VCs, funders, and they will decide for 8 teams that will then enter a 4-week venture incubation program. And at the end of this, there will be a demo day. So this, once again, is a short overview of this. There will be about 36 winning teams, which will then go through a first round of our labs judging panel. We will then decide for 20 teams that will go into this extended bootcamp phase and will present to the global judging panel. And then 8 winning teams will continue in this 4-week incubator program, which once again includes really individualized mentoring and coaching from experienced funders, VCs, and mentors. And then at the end, there will be this demo day. And another advantage of our hackathon is that you will be connected to a quite big venture alumni network, and we will try as best as possible to connect you to our network and to the people who best fit to your idea and solution. So this is an overview of all the current hubs. You might have already seen a little bit in the world map before. We have 20 hubs in 19 countries on all continents. So this will be our largest hackathon so far, and we're really excited about having you join us. These are some pictures from last year. So you can get that's from the Boston Hub. So you can get an impression how everything works. In the beginning, we will have some keynote talks and some insights from our mentors, and then we will break out in smaller groups to work on the team solutions. And this is an example of 2 alumni ventures which have emerged from one of our previous hackathons. For example, there was Clinic Plus O in Guinea, which was a healthcare platform. And then there's also Hera Digital Health, which addresses refugees in Turkey to help them to find the healthcare they need. So we have quite some startups coming up from our previous hackathons. And yes, that's our contact info in case you want to keep in touch. We are posting once or twice daily. And there's also a lot of further information you can find.
Thank you so much, Anne. Thank you, Caroline. Once again, to our participants, in case you may have any questions, please feel free to use the Q&A function and the team will be happy to take up your questions. Anne and Caroline, I wanted to ask you a few questions that I have received, from some of the youth that I was interacting with who are applying for the hackathon. So whichever hub you want to be a part of, once you fill out the registration form, is there any kind of a confirmation they receive, or just applying through the form means that they are accepted and they can be a part of the hackathon? Or if any of the, or are all the hackathon, are all the hubs still open, or is it that some hubs have short entry? If you could just tell us a bit about that.
Sure. So some hubs already closed, including Mexico, Saudi Arabia, Boston, Buenos Aires, and Montreal and Singapore. But all of the other hubs are still open. And once you enter your application, this application will be sent to your local hub. And then this local hub will send you a confirmation letter once you got in. All hubs are requested to do that next week, as our registration closed on Monday. So you should hear back next week with further details, our participants guide, and the challenges.
Wonderful. Another thing which I wanted to ask was that during the 2 days of the hackathon, I believe there would be some mentors as well who will be present that will be able to guide the teams a bit. Could you tell us a bit about that?
Yeah, I'm happy to take that one. So at every hub, we'll have local mentors that are available and walk around. So the expertise and background of the mentors will depend a little bit on each country, but overall they will be the organizers, but also, for example, people that have worked in the healthcare startup space and know how to, for instance, develop a pitch and work on a prototype. And these can also, for instance, be medical doctors and people that know the medical field very well, or people that have been in business and can support you with kind of business and business model related questions. So we will have a wide diversity of mentors in each hub. And you can just kind of, when you're at the hackathon, approach them, ask them many questions, and set up meetings with them if you need support. They're really there to kind of help you developing your idea.
Wonderful. So I have 2 questions. I think we can take those up right now. So one question by Amara is that, can you please elaborate on how will the teams be made? I'm guessing that probably Amara would like to, register as a single participant. So if there are teams that have to be made at the hub, how will they be made?
Sure. Yeah, you can go.
Yeah, so that's a great question. And this year again, as well as the last years, we have many people joining individually. So that works absolutely well. And we also really encourage that because it's a great way to get to know people. And there are kind of different ways to form teams. So the people that will be invited to the hackathon will be added to our Slack channel online. So then a little bit before the hackathon, you can already reach out to other participants at your hub to get to know them a bit and see if there are people you might want to work with. Alternatively, you can just kind of come to the hackathon, and then during the first day, there's plenty of time to form teams. For example, last year in Boston, we had kind of brief introductions by people that were looking for a team so that you know who is there, what their background is, and what their interests are. And if you need support with forming a team, you can always reach out to the organizers or the mentors, and we help you finding a team that is a good fit.
Wonderful. So we have another question from Ayub from Kenya. He says that there are 2 registration centers, 2 hubs in Kenya. One is the iLab at Strathmore University and the other is at the University of Nairobi. So should he register in both the hubs or can he register in just one?
Yes, so for Kenya, we have a centralized registration. So you just register for Kenya, and then the local hub team will assign you. But you could also give a note in your registration where you would like to go.
Wonderful. Okay. Will there be any specific sectors assigned to work on similar to last year when there were 3 sectors, cardiovascular, mental health, and cancer?
Happy to take that on. There will be no specific track like last year, as we really wanted to focus overall on AI. However, there are 11 challenges which will be shared with the participants once they are confirmed, which are a suggestion where they could work on, but it's optional.
Okay, great. So at this time, I would like to invite Dr. Shauna Novak and Runa Khan. Shauna and Runa are both winners of the previous hackathon. Thank you so much for joining us. I'll quickly introduce them, and I think then it'll be wonderful to, sort of know your perspective as well, as former applicants and winners of the hackathon. So Dr. Shauna Novak has over 25 years of experience in global health and peace building, focusing on health system strengthening through her work with the Canada International Scientific Exchange Program, Howard Medical School, the Canadian Red Cross, and the World Health Organization. She has worked with over 44 countries, and her initiatives have received support from organizations such as Ashoka Changemakers, United Way, the Fund for Innovation and Transformation, and Global Affairs Canada. Dr. Novak is a graduate of Howard Medical School, where she completed a degree and postdoctoral fellowship in the Department of Global Health and Social Medicine. Thank you so much, Dr. Novak, for joining us today. We're also joined by Runa Khan, who is a public health innovator, Fulbright scholar, and currently an MSc candidate in epidemiology at the Harvard-T.H. Chan School of Public Health, focusing on innovation and entrepreneurship through her coursework at MIT. With over 5 years of international experience in global health strategy, Runa has led large-scale public health interventions, secured multi-million-dollar funding with the World Health Organization, and driven cross-sector collaborations across government, academia, and international NGOs. As a recent winner of the Harvard Health Systems Hackathon, Runa brings first-hand experience in applying human-centered design and AI-driven solutions to the real-world healthcare challenges. She is also passionate about empowering communities through scalable innovation, inclusive leadership, and tech-enabled public health strategies. Thank you so much, both of you, for joining us today. I think it will be very beneficial for our potential applicants of the hackathon to hear from both of you. So I think first I'd love to know that, what was your experience, of experiencing the 2-day hackathon when you were a part of it. If you could just, tell us a bit about it. Shauna, in case you want to start first.
Sure, great. First of all, I wanted to be able to come and meet people like Runa and Anne and Caroline and the team members I ended up connecting with to build our group and our innovation. I wanted to be able to experience a model for co-creation where I'd be able to think about high-level systems thinking at the same time as using a grounded interdisciplinary approach. And I found that in the Health Systems Hackathon. And, you know, I came from a background in medicine and global health delivery, and you know, looking at different frameworks to strengthen health systems and fragile contexts and conflict settings, except for there's only so far that you can go working within your own discipline or focus or within your own toolkit. And so being there, I got a chance to connect with a top level Google engineer and an incredible computer scientist who ended up becoming our group project lead, and a neuroscientist student, and another med student, and together it triggered the right kind of chemistry that we were able to come up or go through this brainstorming process and end up identifying a need that resonated with us and resonated with enough people that we were able to build something around it, because we were stuck on a why. And oftentimes when you have a why that's really well developed, you can find the how. And you can find that how even better when you're working with people who have different backgrounds and different experiences, and even just different perspectives in general. And so that's what happened, this like chemistry thing where we came together, we didn't know each other, and immediately connected with some really great project management from Ansang, who was our project lead. She's the one from the computer science background. And all of this was put together because we were lucky enough to have this brilliant Google engineer who was able to implement our idea and put it actually into a practical model that we could test as a pilot. So that was really exciting, you know, to see your ideas come into play, and go from ideation to actualization. So it was a really incredible experience. I would encourage everyone who has an interest in connecting with other people, because this is a very people-focused experience, and also those who just have ideas that that need to come out, and you'd love to bounce these ideas off other brilliant minds, and you'll find that there.
So, Shauna, what I'm hearing is that, of course, besides experiencing the hackathon and going through the entire ideation and development process, it was a fantastic networking experience as well, and meeting,
Oh,
lots of like-minded people.
absolutely. It was, you know, this opportunity to network and to be able to learn about ethical technology and do some practical implementation.
Right.
And that embodies, you know, these public health principles and build in the social determinants of health, and, you know, have mentorship, but all of these pieces come into play because this is a center for people who have ideas and want to be able to connect and collaborate, and work with you. And that's really special.
And what I'm also hearing is that you went and formed your team at the hackathon, and
I did.
right? Yeah. So I
Yeah.
think this is very encouraging for all our participants, that, you know, even if you don't have a team, you can still register for the hackathon. You can find like-minded people there, and, you know, we have Sean as an example who went on to, you know, winning the hackathon. So wonderful. Runa, do you want to share your experience with us as well?
Good morning, everyone, and welcome. I think this is a great platform for everyone to start, who are ideating, who are interested in entrepreneurship, innovation, and startup. My experience was wonderful. Building upon what Shauna said, I would definitely say it's a very good platform for anyone who want to initiate an idea, and either they have something in mind or they don't have anything. If they come with an idea, great, they can make a team. And if they don't have an idea, they come it's still a great place because the hackathon is a very fast-paced environment, and you come and the hackathon organize it in a way where everything is very well structured. You come, you speak with the people, you do get the time to find your teammates and network with the students who are participating. And then you sit and each one kind of share their background, what they're interested in, and then they decide on an idea that they can work on. So again, our experience was similar in which we were team members from different disciplines. And I think that's one of the best and strong point of hackathons, where you come, meet like-minded people, network with them, and you make very strong relations with them, be it the team members or others from other teams. And you kind of learn from others as well as your team members about what you guys are interested in. So focus on not on the solution, but on the idea and the problem that you're going to solve. So not be too fixated when it comes to participating, and of course network and enjoy the process of hackathon. It's going to be very fun and fast paced. And I would also say that during hackathon, which was very new for me, every time we were like timed about, oh, now is the time to network, now is the time to ideate, now is the time for you guys to perfect your pitch. That I really loved, and the teams should be aware that those who are participating will get enough time for each process. So be very fluid and not be too much fixated. And as Caroline said, that they're going to be mentors. So listen to mentors, discuss how you guys are going through each process of discussing the problem, and now when it is coming towards the solution, and then pitching the problem to the judges. And of course, the hackathons are all about innovation, and this year hackathon is very much focused on AI. So be very open-minded towards what you're going to work on and how are you going to make teams. One thing that last year people were very confused about, oh, we need people from computer science backgrounds. I would say not necessarily. My team had no computer science person. We had an MBA, two from public health school, and another one from an MBA. So again, I would be saying, come to hackathon with a very much open mind, learn, network. That's the best place where you're going to make a good and long-lasting network.
Runa, I think those were some wonderful tips actually that you've shared with our participants, to come with a solution-oriented approach and with a people-focused approach. I think that is something which will probably come in very handy. Do you guys have any specific tips for our potential participants at the hackathon? Some things which they can keep in mind, while they are focused on putting together their ideas, or even as teams advance to the next levels. Could you share some things which could come in particularly handy?
I would say don't be fixated on a problem that they want to solve. Be very open-minded, discuss it with your team members. What we did last year, each one took some time and discussed what they want to work on, and then we finally decided on a problem based on how pressing and problematic it is. Usually in the entrepreneurship setting, you get some time where you do market research, and by market research I mean you conduct surveys, you talk to people, be it quantitative or qualitative, and you kind of know if this is a pressing problem, and people would definitely be looking for a solution around that. But in hackathon, you don't have that time. So your participants that you are going to rely on is your team members. So be very much open-minded, listen to the team members, be very much flexible, and enjoy the process of hackathon, because you never know what would lead to what. And you might be working on something, and then that could end up being a completely different idea or solution. So be very open-minded and flexible when it comes to being at the hackathon.
Yeah.
I would say The first thing is start with your why, ground your innovation in impact. So think about what the root causes are of the very specific challenge that you're addressing, and think about whose lives are these going to impact and how is it going to impact. And that'll help give you, a clearer picture, because what you want to be able to do is ground your project in lived experience and structural barriers and a specific population. And that's going to help you articulate the urgency and the relevance of what you're trying to create. And then the second point I would say is embrace the interdisciplinary collaboration opportunity. That's really important because you have teammates that will have diverse skill sets. It doesn't need to be computer science. Business, medicine, public health, all these different, so valuable. And you can always find those missing pieces afterwards. But it's amazing what you can come up with when you bring people together with different insights and design perspectives. And health challenges are complex. So it really needs or demands this type of cross-sectoral thinking. And when you're trying to get towards innovation, you need to be able to integrate ideas across disciplines. So this is really important. And then also to keep it human-centered. I think that's a really big piece. So if you're building an app or a tool, like an AI tool or any kind of systems and intervention, you have to ask yourself, is this accessible? Is it usable? And is it acceptable for the people that it's intended to help? So what you're basically doing is a kind of like empathy mapping. And that's really important to do early on in the design process. And then you also want to think, because this is a very intense experience, like it's very compact and just compressed, with both the initial hackathon and then the boot camp that comes next, and all these opportunities. You've got to work strategically with these time constraints. So you're not going to be able to do everything you want, and this is not a place for perfectionism. You want to be able to divide your time almost into like focus sprints. So think about like problem framing, ideation, prototype, design, pitch. And if anyone's familiar with time boxing, that was really useful for us. So like use those time boxing techniques to stay on track. And that'll help you make the kind of quick decisions and aligned decisions with your group that you need to make in order to move forward. And you need to think about not just building a tool, but also designing a pathway to implementation, so that you can think about, you've got this idea, this intervention, how is this actually going to be integrated into an existing system? So who needs to be on board to do that? And I think that's where Runa's MBA teammates may have come in very, very handy. And thinking about what's your sustainability model for something like this, and thinking about logistics and stakeholder engagement and blah, blah, blah. And then when you're pitching it, practice it with clarity. So be very clear about the problem, the solution, the impact, and rehearse until it feels like really true to you and your team, like very, very authentic in what you're presenting. And you have to know what you're presenting. And if it's well delivered, it can be the difference between a good idea and a winning idea. And that makes it compelling. And at the end of the day, you also want to make sure that whatever you're presenting, whatever you design, is rooted in values. So like equity, ethics, empathy, all these different elements. Let your values guide the decisions that you're making, even in the rapid pace of a hackathon. And this is important, because I think that when we're designing these innovations, it's really exciting, but at the same time, we want to innovate in a way that reflects the kind of world that we want to live in. And that means, a place that's just and inclusive and humane. And this is a good place to do that. So I think about all these different things, and I know it's a lot, but I hope that's really helpful.
No, it really is. I mean, I could, hear a lot of things from what you were saying, right? From, using design thinking principles to, techniques like time boxing, to, you know, empathy mapping, systems thinking from the perspective of the target audience that you're trying to solve for. So I think there are definitely a bunch of things which our participants can, you know, probably take back with them. Caroline, at this point, I wanted to ask one question from you, which is that if there are any people who are interested in healthcare and, you know, solving for healthcare using AI, but don't have a background in healthcare or public health, are they still eligible to apply for the hackathon?
Yeah, thank you, Pallavi. That's a great question, and 100% yes. So we really encourage people from many different backgrounds to apply. And even though you might think you don't know a lot about healthcare or you still have a lot to learn, you know a lot more than you think. Like maybe think about your own healthcare journey, maybe think about your parents or grandparents that have needed to seek healthcare and encountered different challenges. All these different experiences can give you a lot of insight in which problems we currently face with health systems and how you can solve them. So yeah, definitely apply. And like Shauna and Runa said as well, it's a great space to network and meet people from other disciplines so that you can together support each other and get even further.
Wonderful. So my last question to the four of you is that what's really in it for our participants? I know Caroline and Anne, you've already touched on you know, how the venture incubation lab would be supporting the winning teams. But if you could just tell us a bit more about that in detail, and also Runa and Shauna, from your experience, how are your teams and how are your ideas supported by the incubation lab? Yeah, Shauna and Runa, we can probably hear of your experience first, and then we could hear from Caroline and Anne.
I would say this was my first time having participated in hackathon, and it was a very good platform to see how these ideas are carried from start to end. There were, I would say, the two best parts for me were, number one, of course, networking, the ability to listen to not just the judges and their perspective, but the team members of these different with different ideas, and they were presenting about their problems along with the solutions. So you get to learn from other people, and if your idea doesn't work, you can join someone else's team. And again, I would repeat it over and over again. It's a very good place where you can meet people from different backgrounds, and you can connect with them. In last year hackathon, we had people from different universities, and one of our team members was from an MIT. So again, a very good place to network, and a very good place to naturally network rather than forcing yourself to network. And that's the best kind of networking that you can have, where you connect based on commonalities between the participants. Second thing was mentorship that we received throughout the hackathon, be it during hackathon or after. We had constantly someone who guided us during the ideation process, the prototyping, and then pitching it. As Shauna said, that time boxing is very essential. So throughout the hackathon, everything was timed. We knew that, okay, now we should be done with this part of our idea and we should move on. And each time before moving on, we had a mentor come, and we also would request a mentor that, oh, at this point we're still stuck and we need to speak with someone who can guide us and provide us with feedback. Again, this was a very crucial part for me and my team, where we constantly received feedback, and I would say that is one of the reasons we won, because you're not only fixated on what you're working on, but you're constantly asking for feedback, and you are receiving the kind of feedback which would help you in your idea and presenting and pitching it to the judges. So each part is very important.
Shauna, you want to tell us about how your team was supported by the incubation lab post you won the hackathon?
Sure. So the mentorship was phenomenal. Without a doubt. And, this was a really rare opportunity to have the chance to really engage deeply with both the health system challenges and work at the intersection of technology and policy and care delivery with the feedback of these experts who are coming from different areas. And you're not just building an app or pitching a concept, you're learning how to co-create viable, ethical, and systems-aware solutions. And you're doing it alongside students and professionals with a tremendous base of experience. And this was a first for me. So I had never done a hackathon before. And so I was really looking to the other students, to the other participants, because there were non-students that were there as well. I was looking to the mentors that we had the chance to collaborate with at different stages, because there were different ones, and the judges as well, because the judges gave us feedback every time we did a pitch, and we were able to incorporate the feedback into a pitch, our pitch as we evolved it moving forward. And so, it's not just experts from Harvard, it's, from the community at large and from industry. And what that really does is it helps us sharpen our thinking, and it also challenges our assumptions that are the basis for whatever intervention or innovation that we've come up with. And for us, our innovation was called SAM.io, and it was something new, and it was something fresh. It was also AI based, and we were able to hear from the judges whether we had grounded this enough so that there was relevancy, and also whether we had communicated it appropriately, because it made perfect sense to us, but didn't make sense to somebody who had no idea about what we were presenting. And that's really important. Lots of fresh set of ears to bounce our idea off of. And for those of you who are watching and listening, that are curious and maybe on the fence about participating in the hackathon, you will come out of this potentially with the prototype, but also with a sense of possibility. And I think that that's really valuable, because we had lots of different collaborators, within our team, and those who listened to our pitch that came up afterwards, in person and virtually, with an interest in potentially working together down the road in some capacity. And we came out of it with new tools, and also a new understanding of how our own skills, whichever they are, could serve a broader mission. And there is a direct pathway for the winning teams to the venture incubation program, and you can take it to the next step and further develop your solution with a tailored support. But there's also other programs. If you don't get to the incubation stage, there's a whole system of support that you can tap into with the advice and direction of the mentors and the judges and your colleagues and peers that you meet there. So this is really a chance to grow, to contribute, be a part of something that's bigger than yourself, and maybe even bridge innovation and impact in a very real way.
Wonderful. Thank you so much, Shauna, for sharing that experience with us. Anna and Caroline, in case you want to, once again, tell our participants about, what's in it for the winning teams, and, how is it that they can benefit out of it, that'd be great. And in case you have any parting words to share.
Yeah, sure. So when you're asking what is in it for the participants, or then also the winning teams, I would really say it's up to you. So the participants themselves, whether it's they're maybe signing up individually and starting to look for ideas, they maybe want to get inspired by the panelists' talks and the experts from the field, or whether you sign up as a team who already has an idea, who want to connect to the mentors, or it's really, you can get out of it what you're making it. So it's really a range of options. And we will try our best to take you from your step where you are. Yeah.
Wonderful. Great. So thank you so much to all four of you for joining us today for the webinar. I'm sure our participants clarified all the queries that they might have, and have, definitely picked up a few tricks, that could help them for the webinar. We have a last question that we'll take up from Shelley. She says that her colleagues and she have registered as a group, and they recently received an email saying that they're trying to sort out teams to allocate with a suitable one. Can you share some insights on this?
Great. Can you maybe share which hub you registered for? Because for each hub, the registration procedure might be slightly different. So I think it's
Looks
not there,
like
but I can maybe just overall share a bit about it. So overall,
Right.
how it works is that you apply via the registration link, and then the local organizers will get back to you. It might take a while because we know that for some hubs we're at or even over capacity. So unfortunately, we will not be able to get everyone into the hackathon. But every local hub will go through the registrations and then make a selection based on capacity and also based on diversity to really make sure that we have a diverse group of participants joining at each hub. So you should be able to hear back from them soon, and otherwise I would advise to maybe reach out to the local organizers afterwards, and we can support you with that.
Great. So Shelley and the team registered for the London hub. And Shelley, again, on Caroline's advice, probably just wait it out or maybe directly reach out to the organizers.
Yeah, so you should hear back next week latest, and otherwise maybe reach out to, I can put my email in the chat, reach out to me, and then I can direct you to them.
Great. Thanks, Caroline. That'll be very helpful. Wonderful. So I think we reached towards the end of the webinar here. In case you guys may have any questions, Caroline has put down her email address. I will put down mine as well. And please write to us and we will try and respond to you in due time. Otherwise, you can also reach out to the organizers of the hub that you're applying for. Great. So again, once again, the last date for registering for the hackathon is 31st of March, which is coming Monday. Please look at you can register using the form. It's a very simple application, should not take you more than 5 to 10 minutes. You can apply as individuals or in teams, and then please wait back for a few days to hear back from your hub. This will be a 2-day hackathon, in-person hackathon on the 11th and 12th of April. So you will have to be there present in person at your hub. I have also shared resources to a couple of FAQs or more information. You can take a look at the 2 website links that I've shared. And I wish you all the very best. And we hope to see you or the other during the hackathon. And again, once again, all the very best. Thank you so much for joining us.